Hello everyone, I am Dr. Shweta Sehgal. Today I am going to tell you something really important. It's an emergency situation. Sometimes when the kids are in the age group of 7 to somewhere around 11 years, they have newly erupted permanent teeth in their mouth and they are very much into outdoor sports activities. Suddenly, one day, your child comes home bleeding, crying, and holding a complete tooth, one piece in his hand. Now, what to do? It's an emergency situation. You don't know what to do actually. So, today's video is all about that what role should you play to save that tooth? Because as a dentist, I must tell you that we can save that tooth. That particular permanent tooth which has come out of the socket, it's out of your child's mouth, can be placed back and can be there with the child for the rest of his life. We can do that as dentists, but we need your help before that. So what help can you provide us? First thing, whenever such situation happens in and around you, the first thing you should do is hold the tooth, take the tooth from your child, hold the tooth from the crown portion. And how do you identify the crown and the root of a tooth? The white portion is the crown portion. The part of the tooth which we see in our oral cavity, these are the crowns. And the triangular shaped, cone shaped yellowish color portion is the root. So the most important thing is hold the tooth from the white portion, the crown portion, and immediately place it in cold milk. Please don't rinse. Please, I repeat, please don't rinse it with water. Hot, cold, whatever. Please don't clean it with betadine or Savlon. Please don't play with the tooth. Don't do anything. Just keep it in milk. Stop the bleeding. And how do you stop the bleeding in your child's mouth? Take some medical cotton. We all have first aid boxes at home. So we have that medical cotton with us. Make a ball of it and just keep it in that portion. Ask your child to bite on that cotton wherever the socket is bleeding, and then rush to a dentist. For a dentist, the most important period is the first 20 minutes of the incident that has happened. Even if you reach the dentist within an hour or so, it's still fine, but preserve the tooth. The most important thing is the medium in which you have preserved that avulsed tooth. If you'll wash it with water, see, a tooth is attached to a bone by a ligament. And what is a ligament? A ligament is like, if this is a tooth, this is a bone, there are fibers attached between the tooth and the bone. This fibrous mesh is called as the ligament. The cells of the ligament will die if you will wash them with water. That is the main reason I'm telling you, don't play with the tooth. Just keep it in cold milk and rush. If your child is in a situation where even the milk is not available, the second best solution is tell your child to keep the tooth inside his mouth, between the cheek and his teeth. That is also one solution. The best thing what I can tell you is just keep that tooth in plain milk. Don't brush it. Don't do anything with the tooth and immediately rush to a dentist. The dentist will place the tooth back into the socket, splint it with a wire, and 95% chances are there that the tooth will be saved for life. Later on, if the tooth, any other problem arises, we have many cosmetic procedures. But the most important thing is the bonding between the tooth and the bone. That will only happen if you will follow this protocol. So I hope today's video is of great help to each one of you. Bye bye. Take care.